Chapter 19, Billing and Coding. As I'm sure you all know, imaging informatics professionals have different responsibilities from facility to facility, usually depending on the size of the organization. At some places, it is the responsibility of the IIP to be aware of how to correctly code and bill for exams performed in their department. If incorrect billing occurs, the organization could lose a significant amount of money. This just depends on the size of the errors. Errors have been known to lead to criminal fraud charges in a few instances. The book doesn't go into deep detail about billing and coding, but it does skim the surface of the topics you should know. Coding focuses on accurately and efficiently completing patient paperwork so it can be submitted for reimbursement to the insurance carrier. As part of the Joint Commission's National Patient Safety Goals, one of the required patient identifiers that are commonly used today is the patient name. And another common patient identifier is the date of birth. So when this is used in conjunction with the patient name, the statistical likelihood of a patient being misunderstood is greatly reduced. These two identifiers together are also used in billing and coding. So when a patient arrives at the healthcare facility, they are assigned a medical record number. This is unique to each patient from facility to facility. The medical record number ensures that a patient is not mistaken for another patient with a similar name, and it is usually cross-matched with the patient's date of birth. You've heard the term ICD-9 before when it comes to billing and coding. This is the International Classification of Diseases, the 9th revision. It is used to classify medical diseases in signs, symptoms, abnormal findings, complaints, social circumstances, and external causes of injury or disease. The ICD-9 coding system is used to code for diagnostic, therapeutic, and surgical procedures, and it tells why it was done. You may also have heard of CPT codes. This stands for Current Procedural Terminology Codes, and CPT codes are used to precisely classify the medical, surgical, and diagnostic services and the procedures. The CPT codes tell what was done. Once the procedure has been properly ordered and imaged and everything is completed, the radiologist will then give his or her interpretation based on the information that they were presented. This usually includes the admitting diagnosis, the patient history from the ordering physician or from the rad tech, any comparative data from other exams, and then the reading is sent to the billing personnel, who then compares it to the necessary demographics and codes that are submitted for reimbursement. They then gather and provide information from what is included in the report, which includes the type of study, body parts, number of views, administration of contrast, patient history, and diagnosis. You can see why it is extremely important that the correct information be included on the information sent to the coders, since they can only go off of what information is provided to them in order to ensure the billing is accurate and complete. Charges are broken down into two components: technical, which is usually billed and collected by the healthcare facility, and professional, which is billed and collected by the radiologist practice. This slide discusses the differences a little bit more regarding CPT codes versus ICD-9 codes. If you want to become familiar with CPT codes, you need to have an understanding of the American Medical Association of CPT codebook. The codebook is a reference for daily issues and has a specific methodology to its overall structure. It's divided into 5 categories. Radiology is one of them, and if you want to see the other categories, they are broken down on page 307 in your book. The format of a CPT code is 5 alphanumeric numbers, and an exam can have more than one CPT code attached to it. Reimbursement rates depend on CPT codes and the geographic area. ICD-9 codes are found in public domain, so you can find them on several sites. Just make sure you have the most updated version if you download it. The format has an optional 1-letter prefix with a 3-digit number with a decimal point followed by another 2 numbers. And each additional number provides a more specific diagnosis and usually results in greater reimbursement. And just like a CPT code and an exam can have, or an ICD-9 code can have more than one code attached to it.